What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last full prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Why did the cow do jumping jacks? She was practicing her calisthenics. What do Keanu Reeves and Baby Yoda have in common? They age at the same rate. What do you call an ostrich in a cornfield? A crop duster.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
And back from 2 weeks sabbatical, it is PA Lydia, everybody.
Hello.
And, nice to see you, PA Lydia. This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at Lady Diagnosis. Well, I don't. It's in the script, and I just said it. Well, you can follow Lady Diagnosis on Twitter. It's fine. Or Dr. Scott WM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Don't forget stuff.drsteve.com. That's stuff.drsteve.com. It's 'tis the season. So check out all the cool things on Amazon, but go there through stuff.drsteve.com. And if you have someone who plays guitar or bass or mandolin or anything like that on your shopping list, scroll down and look at the Rode robotic tuner. Under $200, coolest thing that you'll buy for them ever. And if you're looking for something like that doesn't cost thousands and thousands of dollars for the holidays, the Rode robotic tuner can't be beat. Check out simplyherbals.net. That's Dr. Scott's website. What's going on at simplyherbals.net, Dr. Scott?
We're going to start those holiday specials coming up.
What do you got?
Nasal sprays. We've got the ones with and without CBD oil that may or may not block certain.
So what kind? So what kind of specials are you going to have? You can talk about it on this show.
Oh, that's right. Yeah. So with the fatigue reprieve and the stress less, both they're you can buy like 2 and get 1 for free.
Okay,
maybe.
so it's
it's a good deal. It's a good. I can't remember what.
That's a 33% discount.
Yeah. We try to pattern after the
Tweaked Audio.
Tweaks Audio.
Yeah, and if you want just some earbuds to throw in that are high quality, that with the great customer service, check out tweakedaudio.com.
Yep.
It's TWEAKED audio.com. Offer code FLUID for 33% off of your earbuds. Yes, Tacie.
Also,
Yes.
Hallmark Christmas movies start Friday night.
Ooh, goodness.
Decisions will have to be made. Will she move out of the city?
Or will she go? Yes. Will she go back to her job in the city, or will she stay in the hometown and help with the family business? But fall in love with the handsome fire
like
chief.
they got real decisions to make there.
They
Right?
do. And that starts Friday.
Always with the fucking decisions, these women on these movies.
Oh, you just get ready.
Successful career or hot man
Right.
that loves you.
But then they turn the small town business into a successful career.
So you just get it all.
They get it all, right?
With boobs, usually.
Yeah. Yep. Yep.
Hey,
a lot of times they
So
do.
excited.
Yeah.
Can't wait.
That's
Get
so
ready,
funny.
Steve.
I think I'm over Hallmark.
Hey, make sure if anybody,
I love it.
if anybody does buy anything, make sure they always say they're Weird Medicine friends.
Oh, yeah.
We'll put them a little extra swag in there.
Oh, yeah.
a little bit.
It's nothing special. I think it's a stupid poker chip.
It's a pretty cool poker chip, though.
And then, do you still have the autographed things?
I do have the autographed things, and if we run out of that, we throw them in a.
We're going to have new
Weird
autographed
Medicine
things.
pen.
We had an artist.
It probably doesn't work anymore. We still have them.
You still have some of the pens?
I think
that
I
light
might
up?
have one.
I still have some. We have an artist do us as the Simpsons, in the Simpsons style. And so we're going to have that. And we will have Bristol stool scale mugs very soon.
That's what I'm talking
Once
about.
again, we used to have Bristol stool scale mugs, and now we're going to have them for sale, and I'll let you know. That is a great gift. And if you want the best white elephant gift for a Christmas or Hanukkah party or Kwanzaa party or whatever, any gift exchange, go to flatusflute.com. We get nothing for that, but it is hilarious. And so it's a whistling butt plug, and it is the dumbest thing you'll ever see. And the artwork is brilliant. Son of Fritz did the artwork, and Danny up in Canada makes these things, and so it's brilliant. So flatusflute.com. And check us out on Patreon, patreon.com/weirdmedicine.
Absolutely.
That's loads of fun. And 100% of your questions, if you call us in a question to the Patreon, it will get answered. So, for $5 a month, we would be shitheads if we did any less than that. And sometimes we have celebrities on there who ask us questions. And then check out cameo.com cameo. Yeah, cameo.com/Weird Medicine. Matter of fact, the 4 of us are going to do a cameo as soon as we're done with this. And then we'll go down and look at Liam's car because we've got a really special cameo that we need to do. That's very important. Okay? All right. Well, welcome back, PA Lydia.
Thank you. Good to be here.
And it's good to see you. We were supposed to have a person with giant breast implants call in today.
Damn.
And she was actually supposed to be here in the studio so you could, fondle them and stuff and just see.
Does she live close?
She does, yeah.
Scientific purposes.
And she also had a story to tell. I don't know if I think she got cold feet, what happened, which is totally fine.
I didn't have to touch them.
Yeah, no, I know. And she didn't have to even be here. We could have done it by phone, but she may have just, decided this wasn't, a good thing for her. So,
Well, that's fine.
And it is totally fine. And so I'll just talk about it. She had breasts that she was not satisfied with, and said, if I'm going to get boobs, I'm going to, by God, get boobs. And so she went to this guy and got some really, a full whatever. I don't even know what her cup size
rack.
is. Yeah, she got the real deal. And about 2 years later, she came down with this rheumatologic disorder. And so we talked about it, on the air. There's a very rare thing called autoimmune syndrome induced by adjuvants, which is not well recognized, nor even there are people who feel that it doesn't even exist. And but the research that I did showed that there might be an estimated 1 in a million women or something that this will happen to. So the odds are really low. But I did want you to meet somebody that this had happened to. What happens with some of these folks is they will get a thing called undifferentiated autoimmune disorder. Now, do you ever deal with that, Dr. Scott, at all?
Yes.
So you want to talk about it a little bit, about what happens when this occurs?
We see it probably a lot more than a lot of others, just because it's being undifferentiated. There's not a specific. There's nothing specific to treat. Which is in the Western world, you guys do great things when there's something very specific. If there's an infection or a broken bone or a surgical procedure.
Yeah,
and that's why Western medicine's so superior in that aspect. But we got to have a damn diagnosis.
What a surprise!
It's the greatest herbal medicine ever. But the truth is, we do use it quite a bit for brain fog.
Yeah. So they'll say, these people have this sort of features of connective tissue disease, but they don't fulfill the diagnostic criteria for any specific one. Yeah. And they'll have some abnormal labs and stuff now. So this particular person, whether hers is related to the breast implants or not, is impossible to say. No. It really is impossible to say. And again, this is a very loosely associated problem that a lot of people in the business don't agree that even exists.
Yeah. Do you think it's possible that she may have had a couple of that in addition to maybe a reaction to maybe a flu shot or maybe a sinus infection or something? And I'm not saying I'm not saying any of those things cause it specifically, but maybe sometimes it's a cascade of insults that the body just didn't tolerate well and blew up.
It could be that, response. Or when it could just be the shit just happens sometimes. Yeah. And when it does, you're always going to look for what caused
the low-hanging fruit.
We see this with, for example, with vaccines and certain conditions that children have and stuff that really they've done the studies and there's not an association, but you're always going to look for that thing. And the most extreme example I can give, or the most clear example, is the flu shot example, which we've talked about multiple times on the show, but not everybody remembers or listens, fanatically to every single show. Sean Pedrick can recite this, I'm sure. But, other than Sean. And it's the person who gets exposed to influenza on Friday. And so they're going to develop influenza on Wednesday, but they get their flu shot on Tuesday. Okay? So they were going to get it. The virus is in their system, but they feel fine. They haven't started to have symptoms yet. But it's going to happen on Wednesday. They get their flu shot on Tuesday. On Wednesday, they get influenza. You will never be able to convince that person they didn't get influenza from the flu shot, even though it's impossible. Mm-hmm. So, and when someone has breast implants or anything like that, and then some rheumatologic thing comes down the pike, it could be years later, you're always going to wonder or try to blame it on that thing because it's the one sort of different thing that happened to them. So it may not have anything to do with it. But I just wanted to see you grabbing her boobs here in the studio.
Yeah,
you can grab.
I've never
Really all
felt
he
fake
wanted.
boobs before.
You can go ahead and grab
something
Tacie's
you need
boobs if you
because
want to.
apparently they give you like breast implants to like play with before you get them, or maybe wear.
Really?
Right?
Oh, you can wear them?
Yeah, well, pop them in a bra, like walk around, but it's not the
walk
same.
around and go, "Hey,
you don't know
look at
how
me."
it's going to be like once it's under your pectoralis.
That's
muscle,
right. That's right.
Right?
Yeah.
So
Yeah.
anyway, or above it if you go above.
Well, in 2 weeks, because this part of the bit failed, we will have an adult film person on here who has, I was trying to, Lady Diagnosis has sort of normal-sized implants, and then this other person had bigger implants, and this next person will have extreme implants. And then we had somebody calling in that has breast implants. And I think, I can't remember the story. Either she works for plastic surgery or she had plastic surgery. And she emailed me basically saying, well, everything Lady Diagnosis said was wrong, which I don't know. So I don't think that's exactly right. But she took issue with some of the things that she had to say about it.
Okay.
If there was anything, maybe it was some of the negative stuff that she said.
What specifically did she say?
Well, I'm going to have her in the very last thing.
Oh,
just to
okay.
do, she's would be somebody that would be sort of a modifying influence on all of this.
Okay.
And I think a positive influence, and we'll have her on.
Cool.
So
Thank
yeah.
you for reaching out.
Yeah. Well, I mean, if I can do a long, running bit about boobs on this show,
Oh,
I
sorry,
will do
all
it.
in. He's all in.
That's kind of a no-brainer.
Apparently, there's a culture there, right? Some guys are all about the natural small boobs, and others are like, you better do it while you can.
Yeah.
Seal your deal for getting a man.
Yeah. Oh, wow. I don't know. I don't
That's
think
the advice I got recently.
What, from a guy.
From a male friend.
Well, of course. What are they going to say?
Just better
don't
do
listen to
it.
that.
Do it in your prime, because if you're 60 and you get a boob job,
It's still
you're
awesome.
out of your prime.
No, that's still awesome. I think that's just fine. Now, yeah, some people like small natural breasts. Some people like large natural breasts, though, too.
Correct.
So there's a whole gamut. There's somebody for everybody.
Yeah, it's just finding that. So
Yeah.
increasing your probability of finding someone
but
that will want you.
I want to make sure that, let's talk about this for a second. You don't want some guy that wouldn't be interested in you if you didn't have implants, though, right? You wouldn't want some guy that would,
absolutely would not.
right, right. So you're doing this for you,
Yeah.
not for
Things
them.
just change after you have a baby and you breastfeed.
Yeah. If you just,
Absolutely.
Yeah. Not that I ever had much, but
yeah. So if you're doing it for yourself, then that's the right reason.
yes, it's
So
not for a potential mate
Then we will proceed. Okay. All right. Good deal.
or matron. I'm just kidding.
Just not for anybody.
Just not for everybody. That's right.
All right. Dr. Scott, you got anything for us?
No.
No?
Oh.
What? I sent you like 20 things over the break. Oh, by the way, speaking of the break, the WATP Weird Medicine crossover episode on SiriusXM was quite successful and got a lot of really good feedback for the people that listen on SiriusXM. It didn't come out on the podcast. I'm going to talk to them, see if they'll let us, put it on our Patreon and then maybe slide it over to the podcast side later. And but it was Carl did an amazing job. And if you want to hear more of what he's doing over there, go to whoaretheses.com, I think. Whoaretheses.com. Yeah, that's right. Or just search on your podcast app, Who Are These Podcasts? And it's a roast show. He does Jocktober. Basically, it's just Jocktober. He freely admits he stole the idea from Sam Roberts in Jocktober. He was a big Opie and Anthony fan. He loved Jocktober, but he does it with podcasts. Except during October, then they do it, the regular Jocktober, they do it about radio shows.
I'm so confused.
And it's
We're
so
all
much fun.
confused.
We're all very confused.
Yeah, well, you guys are, but you guys don't know what Jocktober is. So it's
I'm imagining
I
things.
do, and I'm
I have
still
images
confused.
in my head.
yeah, so they make fun of
Men.
they make.
Mainly.
like in their jockey.
Jock
Oh, I
straps.
see. No.
Yeah.
Okay,
Athletes.
so radio jocks, right?
Oh,
So
that's a
Jocktober,
thing?
yeah. So like shock jocks or whatever, and radio jocks. So they would make fun of other radio shows. And back in the day, they would, these sons of bitches, it was so great. They had the Opie and Anthony Army, and they would target some radio show that was just, they were doing a bad job. And so it was funny. And they would have different phases of what was going on with their Facebook page. So first, they would notice something was happening. That was phase 1. And then phase 2, they would shut off comments. And then phase 3, they would take their Facebook page down completely. And it was, the fans of those shows, Tacie and I used to say the fans of Opie and Anthony, Ron and Fez were some of the best parts because they were hilarious.
Yeah.
And they really did funny things. Mm-hmm. So that's what that was. And so he took this and did it, there's way more podcasts out there than there are terrestrial radio shows anymore.
Sure.
So he started goofing on podcasts, but then in October he would go back to the regular format and make fun of radio shows.
Okay,
so
cool.
anyway,
Yeah, I gotcha.
so I'm trying to see if Jim and Sam would be interested in having Carl on like once every couple of months. And, bring in a radio show to goof on, and then he plays clips, and they just do jokes. It's a roast. It's just roast stuff. It's nothing serious. But anyway, so we'll see. But I appreciate Carl doing that. He did a great job. But you have a story or two to tell. Did you bring anything today?
I got a little something.
Oh, you do?
I got something to discuss.
Okay.
Yeah. And I've got one, and actually, a movie Messiah's got a good question when it's time.
Okay.
Too.
Yeah. Sure.
Yeah, so the one I brought today was, pardon me, is an addiction drug that shows promise for lifting long haul COVID.
Okay,
and brain fog fatigue.
That's interesting. So which one is it? Naloxone?
I would give you a bill, but I don't have a bill to give you.
Okay.
Give yourself a bill.
Give yourself a bill!
I give it myself one.
Yeah, I was going to say, so long haul COVID.
I just guessed that, but it makes sense, and I'll tell you why in a second. Go ahead.
I want to hear why it makes sense to you, because it's interesting that it took these guys a while to figure it out. We typically use, because we treat long haul COVID with our fatigue reprieve, because it's got, again, I know it's crazy, but there's straggles in it. But the fatigue reprieve actually works extremely well.
Can you shut up?
But so don't let that cloud your foggy brain.
Okay.
But yeah. So anyway, what the researchers have found out is long haul COVID, which is really tough to again diagnose and treat, as we talked about earlier.
Yeah. It's because it has such a diffuse collection of symptoms that
non-specific diffuse symptoms.
Some of those could be
any damn thing.
PTSD from COVID as well. You just don't know. But anyway, go ahead.
Well, and we're still so young and are so new in the game that we don't really know what is long term or long haul COVID is going to be. Anyway, you're all right. It's naloxone. The drug that's been treated or used to treat. Drug overdoses,
right,
for years and years and years, I guess. And but what they're showing is it has been shown some benefits as far as cognitive deficits, overwhelming fatigues, and some chronic pain syndromes.
Interesting.
Which is really
what dose
incredible.
are they using? Do they say?
Well, I was looking down through here, Dr. Steve. It didn't say, but no. I'm sorry. At 50 milligrams.
Okay.
Which is a low dose.
That's the dose that they use for addiction.
Okay.
And
50 milligrams.
It helps to block. Okay, so naloxone is a thing called a mu opioid receptor blocker. Now, that's just off the top of my head because I did not know that's what they were using, but it makes sense to me. Yeah. But naloxone does some interesting things. When you give someone low-dose naloxone, and now we'll use 4.5 milligrams, very low-dose naloxone, for things like fibromyalgia. So if you know someone that has fibromyalgia and they've tried everything else, they've tried the Lyrica and the Neurontin and all that, the gabapentin and all that stuff, And nothing's worked as long as they're not already on opioids. You know, if somebody just didn't put them on Percocet or something, you can give those people low-dose naloxone. It's 4.5 milligrams. It has to be compounded. Nobody sells it. Mm-hmm. But you go to a compounding pharmacy, and what the theory behind this is that when it blocks the mu opioid receptors, these are the receptors that morphine and oxycodone and hydromorphone and all those drugs will bind to that cause their effects. What are the effects? Sleepiness, decreased bowel function, decreased sensation of pain, that kind of stuff.
Perception,
At high enough doses, decreased respiratory drive. I mean, they got lots of different effects. And they affect organ systems all over the place. But the one we're interested in is the central nervous system perception of pain. And when you give someone a low dose of this in the absence of an opioid, it will bind to those opioid receptors in the central nervous system. And you know what can't bind now is what we call endogenous opioids or endorphins. Mm-hmm. So the endorphins for that brief time can't do their thing because they're being blocked by this low-dose naloxone. But it's such a low dose that it's very transient. But in the meantime, these endorphins are building up, and the body's going, hey, I got to make more of this stuff. And then when it washes out, these things will flood the receptors. And they really work a little differently than opioids do. They work on the same as messengers to the same receptors, but they work a little differently. And what that does is cause a decrease in overall pain in people with fibromyalgia. So it's off topic, but I wanted to get that out there because I know there's probably way more people out there with fibromyalgia listening to this show, or they know somebody that is, than people who have long COVID. And if you know somebody, email me and I'll send you the paper so they can take it into their provider and the provider can educate themselves about it.
Wow.
Okay.
That's a good idea.
But anyway, matter of fact, I authored a paper on it, but don't Google that.
So is that something that I could roll out in my own clinical practice? Because right now I do Effexor and Pray.
Yes.
Or
absolutely. You can. No, you can do it right now.
Yeah.
It's not a controlled substance.
Right. And I could do that if it was, but yeah.
But you could anyway. That's right. But I mean, it's harder to get a controlled substance compounded, but that that can be done as well. We do ketamine suppositories for people with rectal pain, have rectal cancer and stuff all the time. But you can do that tomorrow, and I'll get you the papers and all that stuff so you can back yourself up. I have smart phrases.
It's such a frustrating syndrome to treat.
Yeah. No, it is. It's really frustrating for the patient, and it's frustrating for the provider too, because you want your patients to get better.
Yeah, you want them to come back and say they feel better, and it's very difficult.
I've had really good luck with that, and even other chronic pain syndromes, as long as they're not already on opioids. Because if they are, now the opioid and the naloxone will just fight, and it doesn't do any good.
So, can I ask you a question about that? Wouldn't you discontinue the opiates?
But they got to be off of them for a while.
Okay, gotcha.
Yeah.
Because to me, that would make the most sense.
Yeah, if you could get somebody to...
It'd be some buy-in.
Yeah, it'd be some buy-in. If they're on high dose, they'd have to taper over. I mean, I've tapered people over 3 months before. I mean, I go easy. I got a cancer patient that got cranked up on opioids because of chronic cancer pain, and then they get treated and their pain goes away. Now you've got to get them off. I've done 3-month tapers before.
Right on.
If you got somebody that's on 20 milligrams twice a day, it can take a month to humanely get them off their drug. And so that's a big commitment for somebody if they, if you don't know if this stuff's going to work,
Yeah.
So, but even then, there's probably some benefit to it because if they did have to go back on the opioid, they can go back on a much lower dose.
Sure.
Anyway, so 50 milligrams of naloxone is what they're using for post-COVID syndrome. And are they? So you said it's mostly for the brain fog?
Yeah, primarily brain fog, but they are showing it helps some with the pain and with the fatigue.
Yeah. So what if the brain fog is caused by an overexpression of endorphins? in the brain because they act like opioids. Maybe that's where the fog is coming from. And so there's maybe some mechanism that's causing an overexpression. And when you give people this slightly higher dose, which is 10 times higher than the low dose naltrexone is what we use, they may, it may actually block that and give them some relief from the foggy activity of endogenous or internally created opioid-like molecules. So that might be it. Yeah. And
Interesting.
It's low-dose naltrexone is what we use, but naltrexone and naloxone, very similar molecules. But that's where all the studies have been done for the ultra-low dose stuff. Anyway,
That's
all
good
right.
stuff, Dr. Steve.
Yeah. Very interesting.
Very interesting.
So I'm going to pass that on to our long COVID clinic because I wasn't aware of that study. So if you'll forward that to me, that was a good one, Scott.
Yes.
I'll
Give yourself a
I'll give you a bell for bringing in a good story. What? Might help somebody.
1-to-1. We got
It's
one
definitely
bill of
going to be changing some of my patients, I think.
Yeah.
Some of my management.
Yeah. What else you got? You got anything else you want to do?
Yeah, movie. Well, I've got
ahead.
a real quick question for Movie Messiah, which is actually right on point. He was asking as far as breast augmentation. If someone gets a breast implant, can they still have a mammogram?
Oh, yeah.
Yeah.
Oh, yeah, absolutely.
Yeah.
Absolutely, they can.
Yeah.
And I've seen tons of them.
Mm-hmm.
It can make some things more difficult, which is, again, I think, it's not in the breast tissue. It's either on top of it or below the pectoral muscle.
Mm-hmm.
So if it's below the pectoral muscle particularly, all the breast tissue is
front
separate
and
from
center.
it. It's above it, yeah.
Yeah, front and center.
Yeah.
Good question.
Yeah, we see that all the time.
Yeah, good
And
question.
they'll say, this person has XCC breast augmentation as part of the reading of the mammogram.
Okay.
Now, I do wonder, I know if you squish breast implants, if you have them in your hand, not inside somebody's body, but I mean, if they just hand you the actual implants, you can squish them pretty tightly. And because, Tacie, you've probably had more mammograms here than anybody in the room. When they do that, they really compress the crap out
They
of
really
your
do.
breast tissue, right?
Pancake.
Yeah,
Wow.
so I was always concerned about that. But when you feel the breast implant, it can take it.
Yeah, it doesn't hurt. And
How can that not hurt?
It just doesn't. I've heard some people say that it does, but it doesn't hurt me.
Yeah,
And I have sensation and everything, and it doesn't.
yeah. I know that there's not a lot of sensory fibers in breast tissue itself because back in the day when I was doing primary care, I would do needle aspirations of breast cysts, and you would do it without anesthesia because if you did anesthesia, it hurt longer
Than actually
than
doing
just doing it. Yeah. And once
Now-
the needle was in there, they had no pain whatsoever.
It's a very uncomfortable position. You know.
I haven't.
Okay, tell us about the
never had
position
it.
because I don't even know.
I don't even know how to describe it. You have to contort and stick your
So you put your arm over your head.
boob in this, and you hold on to this one thing and you hold on to this other thing.
Over your
You look like you hug a tree.
Yeah, it's like hugging a
kind of
tree.
like that, but then they have you in different positions. So
What?
it's just it's crazy.
While they're squishing your boob or they're unsquishing.
And they help you get into the position because it's not easy to get it all. I mean, I
Does
guess
the machine, and this is going to sound weird, but does, like in dental imaging, it kind of rotates around your face. Does this move too?
it goes around.
Okay.
If I remember right.
Not with your breast in between two plates though. They don't like start
Does it
moving it
rotate a little
around.
bit?
God, that would be horrible.
Squeezes it and then
Rotates.
and then it goes. If I remember right.
How could you forget that?
Have you ever had a 3D mammogram?
Hey, Dr. Steve, road trip.
I've never
I
had
wonder
it.
if that's any different. The 3D mammography.
It's supposed to be better, right?
Well, all four
But
of
I
us
don't-
are just throwing out. Well, I wonder if I don't know either.
I just wondered if it was like a different process.
No,
But then there's breast MRI. Of
I was
course.
just going to say that the breast MRI, you don't have to do any of that, right? And
Right.
but you have to lay in that tube and MRIs. Okay, when I was training in the 80s, a CT scan would take 45 minutes.
Wow.
And they had giant mainframe computers in there. Now you could do it on a laptop, basically. And so when I had my first MRI, 15 years ago or something, it was 45 minutes. I figured, well, hell, that'll get better. It hasn't. It's still
improved.
45 minutes to do one. Yeah. I had a finger, a nodule on my finger, and this orthopedist wanted me to get an MRI of the finger. So I thought I'd just sit in the chair and stick my hand in there. Oh, hell no. I was on all fours. In the tube, on all fours. I know, it's hilarious and I was praying to Jesus, if you get me out of here.
No one can do that. What percentage of your patients can actually do that?
And not move? I was in so much pain just from having all my weight on my elbows and my knees.
Yeah.
And with my hand in front of me. And I don't know why you have to do it that way. And I was praying to the good Lord above, if you can get me out of this thing, Lord, I'll never.
So when are they
I'll
recommending?
never curse again. It was awful.
When are they recommending mammograms now? It's 40 and above.
Yeah, I'm looking at the American Cancer Society guidelines. It says women ages 40 to 44 should have the choice to start annual breast cancer screening with mammograms if they wish to do so. Then women 45 to 54 should get mammograms every year.
Super glue.
And then women 55 and older should switch to mammograms every 2 years, or they can continue yearly screening. They're just saying they should. And screening should continue as long as a woman is in good health and is expected to live 10 years or longer.
Thank you.
Okay. And all women should be familiar with the known benefits, limitations, potential harms linked to breast cancer screening. All right. And as always, women should know how their breasts normally look and feel and report any breast changes to a healthcare provider right away.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
All aboard! Welcome to the Friskies Express. Please keep all paws and tails inside the train. To the right, you'll see Crunch Canyon. To your left is Filet Falls. Now you're passing Party Mix Peak. Today's Delicioso tour is almost over. But don't worry, with Friskies, there's always more to explore. Check out Friskies.com to explore more.
Bring fun to life with the Instax Mini Link 3 smartphone printer. It's easy to transform your everyday moments into colorful Instax mini prints straight from your smartphone's camera roll. And with the new Click to Collage feature, you can create the ultimate in-app photo booth experience. Instax Mini Link 3. Don't just take, give. Click or tap now to learn more and shop.
Okie doke. Now, you mentioned MRI. They actually bring that up. They say because of their family history or a genetic tendency or other factors, some women should be screened with MRIs along with mammograms. The women that fall into this category are very small. I would assume it would be BRCA positive.
Yeah, BRCA, CHEK2, PALB2.
You want to talk about what that is?
Yeah, so that's where you have inherited a mutation from either parent in a gene that should normally protect you from cancer. So normally if a cell starts going rogue through DNA division, your body would recognize that perhaps through one of these genes like BRCA1 or 2, PALB2 or CHEK2 and turn that process off. So stop that cell line. If you have a mutation that's causing a defect in that gene, then you will not turn that cell line off and you would be more likely to develop cancer.
Okay.
So,
and knowing that you're more likely to have cancer means that you're probably less likely to die from it because you'll catch it earlier. You'll do something proactively to take care of it.
Yeah, so you start screening earlier, so 10 years earlier than the youngest first degree relative. And then so the guidelines recommend annual MRI and annual mammogram. So we split those every 6 months. You're getting some type of imaging.
Okay.
If you don't do prophylactic mastectomy.
Yeah, which means
cutting your breast tissue off.
Right. I had a time before just cutting it off with a pass. And then then those women, some of them will have reconstruction, some won't. Some of them just say, to hell with it. I just don't want to mess with breast cancer. I'm going to take care of this before it happens.
Yep. Yeah. And a lot of women will choose, they'll have their kids first and then go toward it.
Do you think that in the future we could have some sort of CRISPR technology where we could just fix the defect that causes the BRCA, mutation?
I don't know, because your cell lines are already differentiated, right? So doing it in the backwards setting would be very difficult.
Yeah.
But
you do turn over, though. I mean, you've heard of the ship of Theseus, right? Where, you keep replacing boards in the ship and down 100 years from now, there's not a single board that's there, but people have lived on that ship consistently the whole time.
I would imagine
our bodies are kind of like that. The nerve cells don't turn over like that, but other cells do. I just wonder.
I would certainly, I would expect it to significantly reduce the risk of developing cancer if you were able to do that.
Again, this is the speculation show. We're speculating about lots of stuff. We don't know what the hell we're talking about.
What you can do and why it's important to get tested early is that you can go to fertility specialists if you know that you have a mutation, and they can select for eggs or sperm that do not have the mutation. So
really?
Yeah, so I do our genetic counseling
I didn't know
for
that.
the area. I'm not a genetic counselor, right? I work in oncology, but I see patients who say, they just got diagnosed with breast cancer or their mom has breast cancer, something like that. So the benefit of early testing is if you know that you have one of these mutations that will convey an increased risk of cancer, you can go to a fertility specialist and have the egg or sperm selected, right? Because you only have a 50-50 chance of passing on that mutation to your offspring.
How
right?
in the hell do
So
they
then
do
you do
that?
your in vitro fertilization, and they test the genetics of the eggs and sperm, and they select and match only those without the mutation.
Wow. I was like you. I'm like, how are they going to do that once the seed has been planted?
Right.
Yeah.
Once,
So then they plant the seed outside of the body.
Right on.
And
Yeah,
then,
okay, that makes sense.
Wow.
Yeah.
Wow.
Interesting.
Okay. Well, thank you. I'll give you a bell.
Give yourself a bill.
Tacie, you're the only one that doesn't have a bell.
one.
Bill. Give her one just because
you don't
she's
just
awesome.
give out bells.
Oh, but she's awesome. She gets one.
I agree with you, Scott.
Number one thing, don't take advice from some asshole on the radio.
All right. You ready? We've got we have one that's right up your alley, Scott, and then this one. Let's try this one and see. Oh, no, don't. Come on. There we go.
Hey, Dr. Steve, I got a question for you, or maybe that wizard Dr. Scott that sits next to you. I use a CPAP machine, and I fill it with water. Or I tend not to fill it with water because it's annoying, but I probably should. But so, is there something that I could put in the water to make it beneficial to my health? Maybe right now, like when I got a cold, some menthol or something like that. I don't know, maybe some crazy powders from some Asian places. Let me know.
Astragalus.
What? Yeah. You're starting to sound like Dr. Steve.
So, what do you think about that?
Well, my first thing is I'm not going to tell anybody to put anything in there in
there
a
you
CPAP
go.
or anything. No, heck no.
No.
The manufacturers would say no.
No, they would frown upon it. Yeah, but now there are natural occurring or natural antimicrobial agents like oregano oil, peppermint oil, things of that nature. Maybe something you could use, but not. I'm not going to tell anybody to put anything in a CPAP machine. Follow the directions that are on the box or that your providers have given you, and stick with that. But now, he could always use a fancy nasal spray that maybe has
there you go.
Peppermint oil.
That's what I was going to say, is do something
your
before
Simply Herbals nasal sprays, which are
I am
fabulous.
at cpap.com, that famous medical journal, and it has an article, How to Safely Put Essential Oils in Your CPAP for Aromatherapy.
Oh, well, okay.
And then, but
this is not coming from
no,
me.
hang on. And then you come down here and it says, putting essential oils in your CPAP machine is not safe.
There you go,
that what a clickbait title.
Mm-hmm.
It says it does not matter if you put them in the machine itself, in the hose or the mask, or in the filter, or in the CPAP humidifier. So it says here, according to Randy Horowitz from the Arizona Center for Integrative Medicine, if you add essential oils to a CPAP machine, the device could propel droplets of the oil deep into your lungs. In an interview with Dr. Andrew Weil, we know who Andrew Weil is, Dr. Horowitz warns that even a small amount might cause lung irritation. So we're going to say no to that one. Now, but if you want to get some nasal spray that has peppermint oil in it and without, it's FDA approved, right? To the extent that it can be.
That's correct. Yeah.
Then that's that's between you and Dr. Scott.
Yep.
All right.
Yeah, but I wouldn't put anything in the sleeping.
Nope.
No. Sorry, dude.
Yep. Sorry, man. It's a cool idea, but I wouldn't do it. I'm actually, Martin Hoke from Navage will tell you that unless it comes in one of his salt pods, don't put anything in the Navage either. The Navage device, which if you go on our YouTube channel, you could see NP Mel B doing the Navage. And it's funny because she hates things going in her nose, so she was quite humorous about it. But he has salt pods that have menthol in them. And that actually feels really good when you do that. And you get that sort of menthol, that always, tingly.
Ooh, I like it.
I like it too. So anyway, all right. Here, this is one for you.
Hey, Dr. Steve. This is Terry, otherwise known as the Bootmaster.
Hey, okay. Hey, Terry.
You've been extremely helpful to me in a number of ways over the past years, and I need your help now.
Okay.
I have 9 discs that they want to fuse, cervical and thoracic.
Okay.
I can't do that in my own head. 2 reasons. One is I have an issue with anesthesia not coming out of it. Number 2 is I don't need to be more robot than human.
Yep.
So,
well, you wouldn't be, but I
the problem I have is significant pain. The pain comes usually at the base of my skull, can be either side, usually goes down my neck and to my upper back.
Okay.
It can be extremely debilitating, and other days I can be human.
Right.
One of the things that happens, and one of the reasons why I'm calling, is there's something that's unusual that happens, and what that is if I sit or stand and look up 15 degrees, 20 degrees from straight plane, if I look up a little bit, and I do it for more than 30 seconds or so, putting in a light bulb, talking to somebody who's standing while I'm sitting, I get this bolt of pain that comes out of the side.
Yeah. Doc, it hurts when I do this. Well, don't do that.
Don't do it, Don't do it.
So before this call's only about halfway through, but first thing, don't put in light bulbs like that anymore.
No.
go to an occupational therapist, and or you could just do this yourself and go get one of those robot arms and do that stuff that way.
Yeah.
And you can even put a little mirror on it so that you're looking down instead of looking up when you do that even. But there are assistive devices that you can use because you're not going to be able to do those things until these discs resolve, if they ever do. So.
Side of my head, the base of my skull, and goes down to the top of my shoulder. And it is the most horrific pain I've ever experienced in my life. This can happen once a day. It can happen, God knows, sometimes.
Just when you do that one thing. So if you're sitting in a chair and someone wants to talk to you, stand up or make them sit. Hey, have a seat. You don't have to make a big thing out of it.
No, it's all
well, if I look
stuff,
up, I'm going to have... No, you just either stand up or just make it a natural thing.
I'm lucky enough to have it be weeks before it happens again.
Yeah.
Sometimes, as it is today, which was it's horrible today.
By the way, this is why they want to do a fusion on him, so that he can't do that anymore.
I had a...
There's other things that are done when you do a fusion, but we'll talk about it.
My ears will ring.
Yeah.
They've been ringing now for over an hour. The pain has somewhat subsided, which is usually what happens 15, 20, 30 seconds later.
Yeah, Terry, it's horrible, man. I understand the reticence in having surgery. I was on Levy Land recently with Bob Levy and his crew, and I talked about how I basically just said no to surgery until my pain went away. I'm one of the lucky ones. Discs will, over time, desiccate and shrink and, dry out and shrink back to where they were supposed to be when they bloop out like that, because now they don't have a good blood supply. And maybe we should talk about about why a slip disc is a problem, because I sort of skipped ahead.
Well, yeah, and just a couple things, just taking it from the very top.
We'll talk about the spine and the anatomy of the spine.
Well, the biggest concern that I hear him saying when they start talking multi-level fusions.
Yeah.
The first thing you think is, multiple disc failures, but what a lot of people don't realize is many instances it's because of a stenosis. So there's a narrowing of that canal, right? And at first I thought that's what he was describing, but then I kind of changed my tune just a teeny bit, because when he started talking about it being positional,
right?
And then I started thinking like it's probably a disc compression, maybe a spondylolisthesis, which is a shifting of that vertebra, which is another for stability. That's why they'll do the fusions a lot. So a couple things in Dr. Steve, perfect. There are a lot of adaptive devices in certainly physical therapy, occupational therapy, to help you to reset, posturally, make sure that you're doing things appropriately, are really good suggestions. Depending on which levels are affected, epidurals, steroid injections can be beneficial. And you've had those, certainly.
Let's talk about that then. I mean, that's a big jargon word.
That's a big subject we're talking about right here with this poor guy.
Yeah. What I was kind of wanting to get to was the anatomy, just a basic thing. Just think of your spine as being a bunch of balsa wood blocks stacked on top of each other with sort of gummy bear discs in between them.
Right.
And when you stand for 67 years upright and you're putting all that pressure on those balsa wood blocks because of gravity, sometimes the gummy bear discs will just bloop out, and when they do, they bloop out in a way
usually the wrong way,
right? That impinges on nerve roots,
right.
That coming out of the spinal column. And so the spinal column houses this nervous, this network of nerves, but also gives you stability so you can stand up straight. And so, as Dr. Scott said, well, go ahead.
Well, I was going to say, and the way you're describing is perfect. But the other really super cool thing about the spinal cord is the spinal column. Those balsa wood blocks are in a curve. A natural curve, and there's got to be a natural curve, so that if there's ever any insult, there's a shock absorbing component to it. And the other thing is maybe he has an abnormal curve or lack of a curvature, or something that some other therapies can do other than a fusion. I'm not saying he doesn't need a fusion, but I'm saying there's a whole lot of things that we talked about.
Well, they sometimes will have to go in there and take out some of the bone.
Yeah.
to give those nerve roots enough space to breathe.
A laminectomy.
And that's right.
Yeah.
And then when you do that, that makes that vertebrae unstable, and that's why you have to fuse it. Yeah. And if you have to do it on both sides,
if you do it on both sides, right? Yeah.
So they may be thinking about putting rods in his spine. They're called Harrington rods.
Yeah, Harrington, yeah.
And or it may be just a cage going all the way down. And I totally get that.
Sure.
But I would do all the things that Dr. Scott said. So let's talk about the things he can do.
Yep.
So occupational therapy, physical therapy,
acupuncture for sure.
Sure. There's absolutely no reason not to do that as long as you don't go to a nut. Go to someone who, like Dr. Scott, who knows what they're doing and knows the limits of cranking your head around when they're sticking these needles in.
Right.
And then and the next thing is, epidural steroid injections, because those are needles that are stuck in around the spinal column, not in it, but around it. That's why they're epidural. They're around the dura, and which is the lining of the spinal, the spinal column where the fluid is. And they can put steroids in there, and that will induce anti-inflammatory
shrinkage.
Yeah, and and then the discs start going, the shrinkage. It's the shrinkage.
Yes, that's right.
And that's a good thing.
It's a good thing, yeah.
When I had my epidural, I'm telling you, within 12 hours, I could tell the difference. And the next day, I was, instead of crawling up the stairs, Tacie, you remember how bad it got? I was bouncing around doing my thing again. So that's important. And I do everything that you can short of having the surgery. But in the end, if you have signs of nerve damage,
and I was going to say,
foot drop in the lower ones, or your hands are going numb, or you can't grip, or anything like that, that actually becomes a true indication for surgery. You got to have it.
It's I always tell people there's two things to look for: motor loss and sensory loss. If you've got either one, then I get really concerned.
Yeah, then you got to start really thinking about
it.
You
have to consider surgery before it gets too far down the road.
Yeah.
But if it's positional like this gentleman was saying, it's usually a pretty good sign that we might be able to do something non-surgically.
Yeah.
Or at least minimal surgery.
Right. You should at least try it.
Yeah.
But do whatever your primary
the doctor's
team tells you.
Not us. We're just crazy.
We're a bunch of knuckleheads on the radio. Right?
That's right on.
You don't even know if we have
crazy people.
But medical degree or anything, but we like to talk about it.
Yes.
All right. Okay. Here's a good one. Let's see. And we'll go around the table on this one. And actually, that's to kill time because I forgot to Google the answer. You ready?
Hey, I got a strange little question for you.
No.
What bone in the human body is fractured or broken the most, and why? Just one of those weird things you wake up at 3 a.m. and wonder. Think about Tacie.
Oh, Lord.
So are we going to guess?
Thank you,
Are we all going to guess?
Yeah. I do know the answer, and it surprised me, to be honest with you, because what I thought it was going to be was something completely different. So, okay, Scott, what do you think?
Gosh, fifth metacarpal.
That's interesting. Okay, so tell people what that is. And
why
and why you think.
That's my guess.
Yeah.
So with this, the bone on the outside of your hand, it's the fifth bone in your hand, going to your pinky. A lot of people will break.
It's in the palm,
right?
The palm
of your hand,
it's the very edge of the palm. The long bone in your hand that goes to your pinky.
Yeah,
okay,
it goes
so
from your wrist to your pinky. Yeah, I'm sorry.
And
but people, a lot of times when they punch things, will punch incorrectly and wind up punching this, and they get a boxer's fracture, a puncher's fracture, and break that bone.
We used to call it the fool's fracture because only a fool punches that way.
Yeah, right. Yep.
So, Tacie, what do you think it is?
Pinky toe.
Pinky toe?
Perhaps
good answer,
undiagnosed,
good answer.
actually. It may not actually have factored into this.
That's true. So this would be the most diagnosed
because you can't really do anything with it, right?
So people just don't go.
It. Yeah.
Yep. Okay, what do you think?
I have to withdraw myself because I know the answer.
Oh, you do?
Yeah.
Why do you know?
Of course
because I looked it up.
Oh, you looked it up while we were talking?
Yes.
Okay.
I didn't know this was going to be a game.
Okay, well, what would you have said?
I didn't get that far.
Okay, what I would have said was one of the metatarsal bones, which are the long bones of the foot.
Yeah.
And my reasoning for that is, you see stress fractures, all this kind of stuff all the time, is because you put in my case, 170 pounds of weight on those up to 10,000 times a day
They're so
when you're
small.
walking.
Yeah.
And why don't those break all the time? Well, that wasn't the right answer. So, Lydia, what's the answer?
Clavicle.
Yes, that's correct.
No, it's not.
Give yourself a bill.
And it's because kids break their clavicles. They're clumsy and they fall. And my niece Holly broke her clavicle. When I was in primary care, I did some pediatrics, and we were treating clavicular fractures all the time. So once I saw that, it was like, yes, of course.
Yeah.
My doofus nephew, who I love dearly, broke the crap out of his clavicle snowboarding. He hung the front edge, face planted, pow.
Yeah.
That was awful. He had to have surgery for it. He's got plate and screws.
Yeah, and every source I looked at said the same thing. So
Yeah.
it's the most common site for a fracture in children. Clavicle fractures happen to infants during birth as they pass through the birth canal. Clavicle fractures can also happen from falling with your arm outstretched or from a direct hit, which happens most commonly during contact sports. So there
I
you go.
broke mine. I got hit by a car. I was riding a bicycle.
There you go.
Broke my clavicle.
Did you really?
I was like, surely my entire arm is shattered, but it was just a small clavicular fracture.
I ever tell you guys the story of my last delivery that I did? Have I ever told that on here? I think I can tell that. It was 40 years ago. No? Okay. I don't know if I've got time to tell it now.
Oh, boogers.
But, yeah, it was terrifying. It was the last delivery for a reason. I was third-year resident. I was almost done anyway, but it was somebody I'd followed for a long time. And got the head out, couldn't get the shoulder out. It's called a shoulder dystocia. And so I said, okay, I don't want to do the main maneuver for getting this kid out, this sort of screw thing. I'm just going to put downward pressure on the kid's head because the shoulder was right there. Mm-hmm. Can I get it out that way? So I was putting downward pressure on the kid's head. It's just a vagina and a head sticking out. Mm-hmm. And I hear this crack, and the kid comes blooping out, right? So I'm like, oh my God, what have I done? And so I hand the baby off because now I've got to attend to the mom, right? Mm-hmm. And I said, check that baby. And I was sweating bullets. Totally fine. Baby, totally fine. Check the mom. Totally fine. Do you hurt here? Do you hurt there? No. The kid's clavicle, okay, yep. Moving all four extremities, totally fine. I said, never again. That's it. I am done with this shit. I'm never delivering a baby as long as I live. And I have held up to that promise.
Good job.
Oh, man.
Jeez.
You're just going to, if you see someone delivering on the side of the road, just pass them by.
Well,
you don't have the duty.
I know.
I'm just kidding.
All right, Dr. Scott, you got any questions from the waiting room, my friend?
Waiting room, we do. We have a great question. So Scott's got a question about, he just started an antidepressant for anxiety and depression.
Yep.
And he's had a couple of the initial side effects, which he tolerated really well, and they faded away. He said now he's got a little bit of an erectile dysfunction disorder. He said he has no trouble getting the erection. It's completing the transaction.
Yes.
Which
he has
is the
delayed
issue.
ejaculation.
He has delayed ejaculation. So
it's very common.
Holy cow. He says sometimes it takes an hour and a half.
Yeah.
Oh, who got time for that?
Oh, my
I got
God.
no time for that.
Oh, yeah.
I ain't got no time for that.
Yeah, that's like normal.
Oh, my God.
Tacie hates that, too. So we've had to make some adjustments over the years. But, yeah, that's...
in and out.
Yeah, let's get it over with. Let's get this done.
Because she's married to an old man, and who wants to have an old man on top of you?
It's just in and out.
Get it over with. Yeah, I got laundry to do. Come on, hurry up.
So, yeah, so there's an interesting solution that might work for him.
Okay.
One of the things you can do, of course, is change antidepressants.
Yes.
That's one thing.
Because
Another thing
SSRIs are
known to do this.
Notorious for it.
So, but then you're on another antidepressant for 8 days. He's already gotten through most of the adverse effects. Got to start all over again. You could add another antidepressant called Wellbutrin or bupropion, which is it works on the dopamine receptor axis and may reverse some of the adverse sexual effects of an SSRI type antidepressant. When we say SSRI, we're talking Prozac, Zoloft, that kind of stuff.
He's on Lexapro.
So he's on an SNRI. Yeah. So those can still have it, slightly different. SNRI just stands for serotonin norepinephrine reuptake inhibitor. So they are more like the old classic antidepressants like amitriptyline and nortriptyline, which also elevated levels of serotonin and norepinephrine in the brain, which are just neurotransmitters. They're just chemicals that signal between nerve endings in the brain. So you could do that. But the thing that I find the most interesting is taking a non-drowsy antihistamine 30 minutes before intercourse, or maybe even an hour. So you could take fexofenadine. What's the other one? Loratadine. That is Claritin. That's the one that I saw most of the research on, is taking a Claritin about an hour before. Now, you have to schedule it then. That's the thing. But they try it and, do your own research. But if you think that it's something you want to try, you could try it and then report back to us. I mean, it's over the counter. I don't mind recommending over-the-counter things to people if they want to just try something. So that's an interesting solution to that we've had some people who've tried it on this show that have gotten good results. And that's way counterintuitive.
Yeah, that doesn't make sense at all. But well, I'd say give it a shot.
All right, because I'd rather do that if that works than have to just start all over again.
Yeah, and start a new medication. Yeah. Well, good luck, Scott.
And the other thing, Scott,
try it out there, buddy.
Stop beating off. Too, so that you've got...
Isn't there music for this?
Oh, yeah. Stop beating off.
There we go. Sean was actually looking forward to hearing that.
All right. So, but don't masturbate if you're worried about completing the transaction with your partner, because if you're right on the borderline of being able to complete the transaction, that'll kick you over the cliff and it'll be much harder. So you want to have a full batch, as one of our friends on the internet likes to say. So, all right.
God.
That's so disgusting. Anyway, all right. Anything else for anybody?
Yeah, that's
a good question.
That's a great question. Yeah, these are the ones we can table until next week.
Antidepressants are interesting. We just sort of did biopsies on brains and realized that people with depression had low serotonin levels.
So that's how they came up with it.
So we just dump buckets of serotonin in there and hope that's going to do something. And sometimes they work, they're amazing, and then other times not so much. So we need to get a better, sort of more precise idea of what we're dealing with. But as we've said multiple times, we don't know how consciousness works. So when it breaks, it's really hard to fix it. Just imagine Tacie trying to fix and this no flies on you, Tacie. I'm just trying to think of something that you don't have any experience with. An internal combustion engine. It would be very difficult to do.
Drive it to the dealership.
Right.
Have it towed to the dealership.
Yeah.
That's what. That'd even be better.
So that's how we kind of are with brain. Conscious disorders of consciousness. We don't know what the hell we're doing. Ketamine, very interesting though. And ketamine for depression, particularly major refractory depression that might otherwise go to electroshock therapy or something like that, has been shown to be pretty damn effective. Matter of fact, it's on the market now. But you can get compounded ketamine as well, and you got it. As every state's different, so you got to check it, with your prescriber and see if it's even legal in your state to do that. But we're making some progress. The consciousness is the final frontier. We made some pretty good steps with oncology, which was the final frontier. Yeah. But the nervous system is really going to be the thing where we're going to make the final strides in future medicine. All right.
Cool.
All right.
All right. Well, listen, thanks always go to Dr. Scott. Thanks, Tacie. Thanks, PA Lydia. And we will continue your implant journey with you. And we really appreciate you taking us with you on that journey. Thanks, everyone who's made the show happen over the years. And listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at, I think, 10 p.m. Eastern now, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Remember GVAC.